what we're going to do, just like we did in classes, we're going to run through our the needs and challenges we're going to have by reviewing our syllabus as well as the course guide. And I'm sure that will end up leading off into multiple discussions to what we're going to do with clinicals as well as the labs. So give me 1 sec. Let me switch over to the page here. This is available in Blackboard via the syllabus line. Syllabus Blackboard line on the left-hand side, but I just want to run through it to make sure that you guys have the most up-to-date information that I have. If you have any questions, just go ahead and I don't have my chat box open, but I do now. If you have a chat, go ahead and throw something up. I'm going to turn my video off here just for the fact that it's dragging down my internet speed here. There we go. And I shut everything off. So as we move through, if anybody has any questions, comments, just let me know. I'm also recording this and I'll post it up in a couple days in Blackboard once it gets rendered down. Welcome back, third semester. Everybody give each other a round of applause for completing first and second semester. Everybody that's back in, that was here in second semester has made it through into third semester. We certainly, as you all know, have had a lot of things to contend with, especially with COVID-19, since we haven't been together since March 11th, and we were shut down clinically and in the field March 17th. So I have been working with Platinum to figure out where everybody is. Unfortunately, everybody's at different places in their clinical, so that that will lead to a lot of different discussions as we move forward, where it looks like, what do I got to do to complete? Just please know, at the beginning of this discussion, there's absolutely nothing that I can do or you can do about what occurred last semester. So pretty much we can only move forward with what we have. So as new information becomes available and new concepts come out from the college, when we're allowed to go back and everything else like that, that'll dictate what we're allowed to do clinically as well within the field. So here we go, EMS 203, the summer semester, and all of the stuff that I've done just so that I'm aware of where we're at. I have titled everything as COVID next to it, because anything that is next to COVID is up for interpretation as we move along. So just realize that's why you see when I wanted to get this to you last week, I put draft on everything. Because again, it's going to change. I just don't know how it's going to change at this point. So everything that you see in here was basically, you know, had we finished second semester correctly and without the COVID issues, we would be moving forward in the traditional sense. But knowing that clinical and fields may or may not be available, please realize that that's still up in the air. So to be here, you guys can read this. You have had to successfully complete Paramedic 202, which each one of you has. We're in the summer semester, and the time allotment for this is if we were in class between lecture and laboratory, we would do approximately 88 hours of classroom time. That was between theory as well as practical. Now for us, it's very different, unlike the other college courses where they have definitive lab and lecture times. In third semester for us, because of ACLS, PALS, and ITLS and everything else, those things are kind of mixed together. So it's an amalgamation of everything that we do. So again, this, if you look here at number 6, the delivery of content, I got to read this out. This has come out straight from the administration, but the instructor and institution reserve the right to alter, substitute, and or amend the syllabus and or delivery of the material. In extenuating circumstances, a change in class format, for example, the in-person to online may be necessary in the event that such extenuating circumstances prohibit student participation in clinical experiences. Course outcomes will be evaluated using alternate means as appropriate. And that also, in our case, because of the field time in our KHEP needs, that may extend to adding time at the end of the semester, i.e. a fourth semester, that will allow you to get X amount of calls in the capstone as required by KHEP. Faculty, there's me. And as you can see, since I did get my national registry a couple weeks ago, I did put that in there because I'm a whacker. With that, Dr. Rehart, and then beginning this semester, Bob Hollinger will be our program clinical coordinator, as we've discussed previously. So as far as evaluation and what your grade is going to be drawn from. So because of Josh's return, as I've always said, if there is something that is outside of your control, you can't be held responsible for it. So with Josh leaving last year, I've had to, the way to evaluate everybody is basically hold the standards of when everybody is assigned in class. So for everybody but Josh, you'll follow the 2019 to 2020 cohort where it says platinum, because Josh did not have access to platinum. He has actually access to FISDAP. So Josh, you're going to be held to the standards that say 2018, 2019 cohort FISDAP exams. So you'll be responsible for those exams, while everyone else will be in platinum working on their module exams and their preparatory exams using the platinum exam list there. But it says there, you, regardless of which planner you're using, whether you're using FISDAP or platinum, you will have 2 attempts on each of these exams listed here to achieve the highest grade. But you have to take your second attempt within 1 week of the initial exam submission date. If you don't do that, that's the grade you get. So with that, so everybody here has 2 attempts at each of these exams to get the highest grade that they possibly get. Please remember, you have to graduate this semester, you have to have 80% greater cumulative average. But again, you're getting 2 sets, 2 chances at each of these modular exams. Please note that when you're on with Platinum, you're going to have to download a lockdown browser. It's called Respondus. So please be mindful with that. You'll have to read that up in EMS testing for Platinum policies and procedures with doing that. Now, all of you are responsible for this portion here, all of the assignments. Please note, your research presentation is going to be due either on Monday, July 27th, or July 29th, Monday or Wednesday. Now, again, whether or not that is virtually presented or in person, I still don't know. So at this point, please plan on doing it virtually. But if we can get everybody together safely and within CDC guidelines, we'll be at the college for that. So please be mindful. So the research paper is due by end of class, I believe, or 5 o'clock. I'll have to look at the course guide. Will be due no later than 7/13. Which is, I believe, a Wednesday. I'll have to get the course guide. We'll look at that in a second here. Actually, if I bring it here, I should be able to see it. There we go. So if you look here at the course guide, exploratory papers due via Blackboard by 6 p.m. on Monday the 13th. All right. With that, so just be mindful. It's listed all over here. All right. So that needs to be uploaded. You don't have to upload 2 copies, but this just carried over from last year when everybody had to turn it into me. 1 copy was for me to mark up, and the other one was for you to keep. But again, that'll be uploaded through Blackboard, and that will be graded upon the, if you go into Blackboard, you'll see that there is a rubric there, not only for your presentation, but also for the paper, and that will be graded appropriately. And please remember that your research paper the grade that is achieved will be across the board for you and your group. Your research presentation will be graded individually by your classmates. So that's something I have to work out. If it's face-to-face, it'll be a lot easier. But if it's going to be online, it's going to be a little bit more difficult. I'll have to figure out how to do that, whether that's by whether I send everybody the paperwork, you print it off and then scan it into me, or if I make a Google Doc or something like that. I'm not really sure how I'm going to work that yet. But please keep those in mind. There are 2 hazmat assignments on board. There is the MSDS as well as the hazmat worksheets. We'll walk through those here Wednesday or so. But again, those are worksheets that you got to print them off and you got to handwrite them and then scan them back in as assignments. Currently, there is only one place to grade them, to upload them to, and I know a couple people have been on top of it and pointed that out to me. So, but after this class or so, I'm going to end up making 2 distinct assignment areas for them to upload each one of those assignments. I just forgot to do that. NIMS 700 and NIMS 800. Please remember NIMS, upload them after you're done, but please remember, if you need the Con Ed, upload that via Con Ed by endorsement. You'll get Con Ed if you need it going forward. Also, we're going to, I didn't get a chance to do it last semester just because of everything else, but if we ever get back into the field, I'm going to review 2 of your PCRs. And this semester, instead of them being worth 14 points each, they're going to be worth 100 points each. There's a little bit more on there. I've been noticing some of your PCRs were missing assessments, or you would just put vitals or stable. You get called into a lawsuit. That's not going to hold water. So I do have and have had a rubric up there on what I expect for a good EMS PCR, but that's going to be moving forward. So ACLS PALS and ITLS exam pre-test, those are worth 10 points each. You have to take them. They don't go against your grade or anything. It's just that ACLS and PALS and ITLS require that those be done. So please, ACLS pretest has to be uploaded by class time on Wednesday. So note that, but you get 10 points for doing that. Doesn't matter what it does, but it allows me to see what you knew before and then what you know after when I look at the exams. Now this one here, when we look at NREMT permission to test form, the NREMT permission to test form is extremely important when it comes to your psychomotor exam, because if you don't register with the NREMT for the psychomotor, you can't sit for it. You can't come to it. So once we make the decision on whether or not we're having that this semester or not, that's going to be due. And all that is you going to the National Registry. If you already have an account set up, all you do is request for submit to me via that website a permission to test. I clear you, and then you get assigned within 72 hours, you get assigned a PTT form. That PTT form then needs printed off and loaded back into Blackboard, so I have that to where I can present that to the state and the National Registry representative for permission to test. So that's extremely important. I didn't put a due date on that one as it previously had, just for the fact that it's only good for 60 days. And if we end up having to push that psychomotor that's originally scheduled for August 23rd forward, that's going to be a waste of time. So I'm just letting you know there, you're going to have to log in, and it's going to take 15 minutes to get it done. But if you don't have that form, regardless if I know you passed or not, if you don't have that day, by the time that it's required, you're not going to be able to sit the test for the National Registry on the psychomotor exam. And then finally, the big test that is separate from all the others is going to be your comprehensive, predictive, cognitive, programmatic final. This will be administered through FISDAP as well as Platinum, and it is not included in your semester total point value. But you must pass this exam with greater than 60%. If you, after your third attempt, if you do not pass this exam, you will not graduate this program, and you will need to retake an entire paramedic program over again. But you do have 3 attempts at this exam, whether it be through Platinum or FISDAP. And they are not the same exams. Like your modules, these are completely different exams, and they will be 200 questions each. So you will have 60% or better to pass that, because that 60% on both exams will estimate that you have an 80% chance of passing the National Registry Cognitive Exam on your first attempt. And that's a KHEP requirement. That's not just the program's requirement. That is a KHEP requirement. So for our total point value, if we look at everything and nothing changes here and there, if you're in the 2018-2019 cohort, you're looking at about 1,280 total point value. And if you're in the 1920 cohort value, you're looking at 1964 for your total point value. But again, please note that this can change at any time based on what our requirements are going to be for COVID or anything else like that. Does anybody have any questions on this so far?
Hey, Rick, regarding the permission to test form,
yeah,
I'm assuming we'll have some level of communication with you about where we stand with our clinicals so that.
Oh, yeah. I'm going to.
Go ahead.
Yeah, no, I'm going to break down reports, and we're going to have a one-on-one office hour within the next week or two. I am not, just so everybody knows, I am not expecting us to be able to get back into the college until at least June 29th. And we'll talk a little bit about that more as we get into lab and we actually look at the course guide, because there's some blaring holes there, and I'll explain to you why they're there. But yeah, no, it's you and I and everybody in here are going to be meeting to on multiple occasions to, one, limit your anxiety going forward, but also to let you know what I know. I know if you are on Facebook and have gotten anything from or a part of any of the regional councils or the EMSIB talking about the return to education. While that is, that's from the state level, it's up to the institution on how they're going to do that. I have been in contact with everyone's field sites to ask them, once the college allows us to go back to clinical and field time, are they willing to accept you back? And each and every one of them have said yes, no problem. But there will be changes to, PPE. Who has to provide the PPE? All that stuff has to be worked out in the mix as we move along. But I'm not expecting that until June. I know last week there was a high-level meeting with UPenn and LGH as far as getting people back into the clinicals. I had to give them, our preferred clinicals and the times that we would need, and I haven't heard anything. We do have a program directors meeting tomorrow at noon, I believe, and we'll be going forward with that. So that, again, I'm working on it, and as soon as I have answers for you, I will be forthright. I mean, you guys get the same emails I get from Mary Grace and the college. So I'm not holding anything back. And we'll talk about the lab days, because again, the third semester was not to have any labs other than Monday, Wednesday nights. But with social distancing rules, what we may end up having to do is, because we're not allowed at this point to have any more than 9 students in one class, because we're limited to 10 individuals in one normal classroom space or lab space. So we've limited our labs to 6 to 1, 6 students to 1 instructor. So we're covered with that. But how do we do that? And one of the questions was asking the students if, instead of just instead of coming in on Monday, Wednesdays, when we see the course guide for labs, we do a Tuesday, have Monday, Wednesday, and Tuesday, Thursdays for those that might be available, because again, we still need to get in and I need to complete those labs that we missed last semester, because that ties into all of the clinical stuff that we need to do that we just physically could not do online. So that's something, again, we're going to keep moving and like I said, my hopes and plans are to have you guys done with everything by the normally scheduled time. Granted, your clinical and field time will be reduced, but I'm planning on that to have you guys up and done and ready to go, not only for the cognitive, but also the psychomotor. And that psychomotor is very important because, you know, you guys have all read, we've all talked about National Registry is giving provisional certifications, and the state PA is accepting that with no psychomotor. But if you want your National Registry, you will have to successfully complete the psychomotor by 12/31/21 at this time. Now, if you want to go out of state, you're going to end up having to pay for it, anywhere between $50 per station up to, I've seen it as high as $500. Whereas you guys paid for us to give you one, so that means we're going to have to give you one, whether it's in August or if I'm going to have to reschedule that at a later date. I don't know, but that's because again, you know, the issue is going to be is if you choose not to take to the National Registry, that's your decision, but I have to be able to offer it to you with that. So there's some pros and cons with that, but I'm going to give you everything that you guys signed up for. All right. It's going, Josh, we'll talk offline later, but it's not, I'm using the term lab very loosely. We are going to try to schedule lab sessions to follow ACLS and PALS and ITLS on class nights. So you're not going to have to, like you did previously, you're not going to have to attend another lab. We're going to get that on Mondays and Wednesday nights. So, but we'll extend that a little bit later with that. All right. So as we move down, Sam, I know it's always long-winded when you give me a question, but did that answer it for you?
Yes.
Okay. So a couple other things here as we move along. Please note, during the semester, the following should also be achieved. 1, successful completion of ACLS, ITLS, and PALS. While these are not required for course or program completion, you need these to get jobs out there. All right. So when you get out there, please note that these ACLS, PALS, and ITLS are those final test scores are not included in your final semester, but you're subject to passing them within AHA's and ITLS's policy. So that includes doing the pretest, which ACLS and PALS you guys do through their own website, and then upload that proof into Blackboard. ITLS is a test, is a handwritten test, is a test that I've been provided, but what I did was I took the hard copy because I can't get you to a hard copy. So what I did was I converted that from, you know, a Word document into a Blackboard test. It is an ITLS test. It's just that I've changed the way that you access it. Instead of doing it pencil to paper, you actually do it on Blackboard. And then that comes to me. So you have to do those. And then your final certification examination is graded differently. ITLS, it is an ITLS exam. Again, it's online. All I did was transfer it from a PDF Word document into Blackboard. Same thing with ACLS and PALS, but ITLS requires you have, they're all 50 question exams, but ITLS requires that you have 74% or better to pass. And then ACLS and PALS requires 84%. And each one of these exams allows you to retake the exam a different version, because there are A's and B's, a different version. You are allotted 2 attempts at retaking that exam following a remediation. So that's something to keep in mind. You may go through and take ACLS, but you fail it and get, you know, 74% on ACLS. after you graduate, before you get committed, you're going to have to take another ACLS class somewhere. All right, so please be mindful of that. All right, so these tests do mean something down the road for you. All right, and just to reiterate, you must achieve a 60% or greater on the Platinum FISDAP comprehensive exams within 3 attempts by August 7th at 5 p.m. To pass the program. These are not included in your course totals. These are completely separate, but 60%. And you have from Monday to Friday to take these tests 3 times. All right. So please be mindful of that. It's fast and furious when it comes to that. Overall grade, again, as we move here, overall grade 80% or higher is required to pass. And again, here you could see, I'm just reiterating here, must obtain 60% or better. I'm sorry, the FISDAP exam is 200, or Platinum final exam is 180. Now let's get down to clinical requirements. Now, please note, all of this stuff has COVID after it. Okay. As we move along here, just realize that this isn't a perfect world, what I would like you to get done. But with limitations, as well as everybody working, and you know, your schedule work and all that other stuff, I'm very attuned to that for you guys. But basically, you know, we reserve the right to modify the final clinical or field requirements to reflect the needs in the era of COVID-19. These requirements might require the addition of a 4th semester, which is fall 2020. And that would be with no charge or anything else like that. It's just that we got to give you an I grade, and that extends out to get all that stuff done. So as I state there, the situation remains fluid and changes on a daily basis. But again, that number 1, I just left that there because I didn't want to remove it. Continuation of semester 2, unmet clinicals. You know, as I said, everything from semester 2 is pretty much moot now. But if there's something there that you really wanted to do that you didn't get to do, that's not listed in one of these other 9 areas, I'm all for you guys going and doing it, like going to do EP or something like that. I'll gladly give you credit for something with that. But the one thing I do want to do, we need to get back in the ER. Because, you know, you got it. That's where you're going to use the most of your skills. I want you in there. I want you to get, because some of the things that I found out going through your clinical is you're light in a couple things. And the majority of you are light in seeing pediatric patients. So if you get back to the ER, one of the things that I'm going to tell you to do is I want you to start cherry picking. This is where those individuals that in semester 1 and semester 2 saw everybody and documented everybody is much better off than those individuals that didn't. You know, this is where that comes in. Oh, those debates that we would have about, you know, the 10% rule on BLS patients. This is where it really helps me out, and it helps you out, because what everybody here is going to have to start when you get back to the ER is cherry picking the pediatric patients from newborns up to adolescents, and you only have to see 2 per age group, but a full assessment, all that stuff. So that's really why you know, practice your IV techniques, get a chance to get a couple live intubations if Dr. Rehart's working, all that stuff, but just to get back into the flow, because we haven't been doing this stuff for almost 2 months now. So that's very important. Field clinical pre-hospital, again, 175 hours was listed across the entire semester. If we don't get in there, I don't know what we're going to do, you know, how that's going to look. But what I'm looking at is, you know, previously we always required a minimum of 33 team leads in the capstone. I don't, and again, you're not going to, you can't hold me to this, but what I'm looking at is KHEP. Their refined minimums are at least 20 ALS calls, 20 ALS team leads. And what I may end up having to do, if we can get back into the field, we go right to those 20, but they have to be 20 ALS. I can't give you a sloppy, you know, 10% rule at that. We need 20 ALS contacts. So that's going to be something that's going to be looked at. And once we get cleared to get back into those areas, I'll make a definitive decision along with Dr. Rehart on how we're going to proceed with that. A couple other things that I would like to see you do is get up and do the trauma neuro, the TNU, if you can, as well as get in with the trauma team. We worked really, really hard for that. I was really excited to get everybody in there, but it's one of those things where if we get the chance to get you in there with the trauma team. And then the other ones that are, these are the ones that are really, really, really important, other than getting your ALS team leads in the field, as well as that 50 hours in the ED to help you get those adolescent and newborns and stuff like that and a live birth. Is I really, really, really want you guys to get to the over to women's and babies and get a neonate ICU shift in the newborn nursery couplet care, or if we can get you into a pediatrics group, as well as L&D. And again, that's going to be completely up to date, up to the clinical sites to allow you in or not. In or not, we will be doing birthing in the labs once we get back in, when we get to PALS. After that, we do have a Fanny, which we can simulate a birth. We will be utilizing that, but nothing beats the real thing. So those are a couple of the things that I'd like you to get in there. And then the final one there is the IICU. And that's there, honestly, to help you guys with your drips. And because all those patients, as well as in the trauma neuro unit, that's where you're going to see potentially ECMOs, patients on ECMO. And John Davids can comment all day long when it comes to patients, when it comes to ECMO and, you know, the influx of ECMO we've seen in EMS. And the reason why I say that was when John was a student, he did his research project on ECMO. And what was that, 3-4 years ago, John? It was almost non-existent other than in the European theater. But now we've seen every major trauma center pick up on ECMO. And I know there are some services now nationwide that are doing ECMO in the field.
Yeah, I think it's kind of like maybe like the GO team out of University of Maryland. They have a team from the hospital respond out to the field, meet the medics, and place the patient on ECMO. And that's, I think, being tested down in Texas right now.
I do know that the city of Pittsburgh is working on it right now. I went to a lecture last year with Mark Pinchot. And they have an ECMO team with their doc that we call them out in Pittsburgh. It's called the Bronco doc, where the city of Pittsburgh and their EMS fellow ride around all night with a EMS physician. And based on certain criteria, that physician will be transported to a cardiac arrest or whatever. And they, along with the rescue team, because in the city of Pittsburgh, EMS does rescue, along with the rescue team, they will dispatch a second unit and the rescue team, and the EMS fellow will begin ECMO in the field. But it's a very limited protocol. But it's something that technologically within the last 3 years, we see it constantly. We're seeing it more often than not now. So students must satisfy all required documentation of clinical and field experiences. Again, all the paperwork is going to be required. As you guys know, I was chasing people down even up until the end of the semester for all their paperwork for last year, because for last semester, because if I don't have that, I can't prove that you did anything. That's something to keep in mind. Also, Brandon brought this to my attention yesterday, and I believe I fixed it. But Blackboard shut down semester 2. And access to that. I did go in last night and reopened it, but please note that semester 1, 2, and now semester 3, and all the associated resources should be available to you 24/7. Brandon, were you able to look at semester 2?
I was able to access that.
Okay, good. Yeah, even though I had a continuous, it just shut down for some reason. I have no idea. So everybody should be able to get into that. And again, yes, who's talking?
Sam Grimm. With all due respect, don't those all the things that you're hoping to get done seem a little unattainable at this point in time? I understand that we're hoping to get back to clinicals, but what if we don't? And what happens if we don't get back until a fourth semester? Are we just going to do the 20 and some time in the ER, or do you still want us to do all of those hours?
At this point, it is a best case scenario that you do all of them. But if we only get into the if we have to go to a fourth semester, then at that point, and again, don't hold me to this because again, I'm preparing for the worst and hoping for the best. The ED, the field, and the pediatric stuff. That's what that is in my, looking at my magic 8-ball. Going forward, if we have to expand into the fall semester, what I'm looking for you guys to do is going to be the ED, is going to be the your field time. And again, if it's getting down to, I'm not going to hold it to the 175 hours. If it means we only have to do 20 calls, I'm looking at, if you get a run and you get 20 calls, you got 20 calls. I'm not going to hold anybody back from graduating because you didn't get 175 hours. You get 20, you walk into a poopy show and you're at the end, we get back in the end of July and you run July, 3rd through July, 20th, and you end up getting, 20 ALS calls in that time frame. I'm good to go. You're not going to have to sit there and wait and see for 175 hours at this point. At that point, we're going to look at competencies. But again, I want, as we go through, I want you to keep an eye on your patient contacts, and as we're going along, because I want everybody to have at least, especially when it comes to that pediatric stuff, when we go along, and as we start going through all your time frames, with all your patient competencies and contacts, you'll see that's where it's going to come. Like I said, everybody that documented everything it's going to be a lot easier for me to say, okay, you're good to go, than somebody that was picking and choosing at that time. So I hope that answers your question, Sam, but I'm looking at this with, through rose-colored glasses. But trust me, no, you're not going to, if everything, because everybody's lifestyle was supposed to change back after August 23rd. And I understand that, but you have to realize that, to make everybody competent and get out there and working and have your, because if I don't meet those standards in a certain way, I'm afraid that you guys are going to fail your national registry, therefore not complete what you started out 9 months ago to complete. So I have to weigh both, what we think is best versus what gets you just the bare minimum and make you a competent entry-level practitioner. So please note, no, I'm not going to stand there with with Merlin's staff and say, oh, you will do this. No, I will give you everybody every benefit with the extenuating circumstances that we have. All right.
Okay.
So again, at the end here, it says by the end of semester 3, students should and/or will have a minimum of 99 pre-hospital ALS contacts. That was in a perfect world. Pretty much, as I said, everything from the end of second semester, second semester is moot. We can't go back and throw that. Like I said, if you guys want to go back and do something that you didn't get a chance to do, and we're allowed in that area, yeah, you can certainly do it. But if we're just going to get, just the minimums and to get what we need to do to graduate, that's what we're going to do. All right. As we move along, the textbooks, nothing has changed. You guys already have your AHA books, your PALS, and your ACLS. I do have 8th edition ITLS books available for you. I never foresaw that I wouldn't see you guys face to face enough to be able to get these to you. They are all at the college. So I have not been allowed to I have not been permitted to be on the college campus since that week of March 17th. But I will get them to you. Don't go out and buy one. Ramey, I know you had emailed me. If you have a 9th edition, that's wonderful. But I will try to get, as soon as I'm allowed back on in, if I got to mail them to you or whatnot, I'll get them out to you at this time, but do not go out and buy them, please. They're absolutely excessive in price, and I have just as good as books for you to borrow. So just know that with that. So you can go over and read your course objectives. And again, this just follows ACLS and PALS. Talk about, and again, this semester and last semester, we were supposed to do some stuff at the stuff at the Fire Academy, which again is moot at this point. We're not going to be able to do it. But again, we are going to show at the all in all, demonstrate technical proficiency in all skills required of an entry-level paramedic and demonstrate personal behaviors consistent with professional and employer expectations and entry level. All this stuff here, is just basically boilerplate, everything that we've seen previously. Please remember, all submitted written work must be typed and follow APA guidelines. Please note for your paper, I know there was an email that came out, I think it was last week by Dean Hershey regarding where the PA College will now go, I believe, with the 8th edition of the APA. So there are some resources online through the library and everything else like that. But please start using those when you have to research and do bibliographies and stuff like that. Some of the changes to the APA that Gene Hershey says I've been doing for years, like you don't need to have a running header for your paper. We're not actually doing research, we're exploring a topic. So those are a couple things there. And if you have any questions, you can either contact me offline or we can work with Amy and get you guys some assistance when it comes to that. So other than that, that's pretty much it for the syllabus. Does anybody have any questions on the syllabus at this point? All right, so course guide, again, available in the syllabus portion of your, right here under where it says syllabus. There you go, there's the course guide and the draft version of this. But again, when we look at this, please note, labs I've left open, I've just left them there. But again, we're going to meet, unless you hear directly from me, we're going to meet Mondays and Wednesday nights from 6 to 10 for lecture and whatnot. Please note that there is a bunch of videos up online because ACLS and PALS are all video driven. So please watch those. All of the PALS videos, I've put up what I can so far. I've got a couple more that have been giving me technical difficulties that I'm trying to get rendered and put up there, but I'll get those as soon as I can. But basically, the pretest is due by 6 o'clock. Just upload it. Okay. Please remember next Monday, no class. It's Labor Day, but we'll have ACLS and everything again on Wednesday. And then Monday, we'll finish up with ACLS, and then we will open up the ACLS final exam via Blackboard. And that will be open for 1 week. It'll be due by 6 o'clock. And again, you have to have greater than 84%. When we look at Wednesday, please note, I'm going to fill something in there. We will have lecture. I just don't know what it is as of yet because I didn't want to start PALS on a off day. But we'll do some review and everything else like that as we go through, because as you'll see tonight with my lesson plans, there's a whole bunch of stuff that prepping you in preparation for the National Registry with that, because I will tell you, one of the plans is if we get done with clinical and field and we get everything done, and let's say we go back, July 1 or whenever, and you're able to get stuff done, but we end up having to postpone the psychomotor until December. But let's say you get done with everything end of August. It's just that we didn't get everything done to run that psychomotor exam. I will clear you early, and you will be eligible. I will make you eligible to sit for the cognitive exam, which means you can get a provisional certification. Which means if you get that provisional certification, Pennsylvania will give you your full certification, which means you can begin working as a paramedic. What that will mean is we will have to come back at some point, and we will get you a psychomotor at the college. But when and if that comes down, but I will not hold anybody back. If we complete everything, I will not hold you back from taking your cognitive and therefore getting your psychomotor. But again, that's going to be dependent on what the COVID requirements are going to be at the time. The state can yank that at any point. I don't know when Director Ferguson's going to do that or anything, but that would be my plan to get you guys up and done. Like I said, if we end up having to extend into a fourth semester, once you hit that magic number and we move forward, I'll clear you for the cognitive, and then you can just come back for the psychomotor. All right? Is everybody okay with that? Yes, no, maybe
I'm
so.
okay with that. I like that.
Okay. Like I said, I'm not trying here to hinder you. I just have to meet all that, and if you can go and take the psychomotor, if you can go and take that written and get your PA cert and start working and making more money and all that other stuff, you can always come back and take that psychomotor. You guys will always be welcome back, and we'll get you one at no cost. But it may take, depending on when we're allowed to do it, because one of the big arguments at the state is, even at the EMT level, is when do we safely bring everybody back to do psychomotor testing, especially the integrated out of hospital, where you have to, you should have a live patient. Right now they're recommending, high fidelity simulation. And I don't know if we're ready for that. So we'll go forward as we see fit. So ACLS and PALS, and then ITLS as we move forward. Now notice that there are exam dates over here. ACLS and ITLS I put here on the homework and exams, and then your Platinum FISDAP exams. Please note that your preparatory module for current students is going to open on Monday, 6/8. There is no FISDAP exam. You will have 1 week to complete that. All right, and you'll have, because it actually, I started to open those at noon and they close at 6. So you'll have a little bit over 7 days to complete that. Those will be through EMS testing through Platinum. You guys should see those if you go to your Platinum page and you look at EMS testing. As a student, you'll see those will open up at a given time, and everything else like that. For the FISDAP, Josh, you should have received your list of days as well as the passwords for logging in on those appropriate days. So if anybody has any questions with all this testing, it's fast and furious. Basically beginning class 6, Wednesday, June 3rd, you're going to have a test a week. With that, and all that's going to be required, plus the assignments and everything else like that. So don't fall behind early, because regardless, even if we extend into that fourth semester, that extension into that fourth semester is going to only be for clinical and field time, not for academics. All right. Now, as we move down, as you can see there, after class 15 or week 8, I've got TBD. That's to be determined, because in our previous schedules, this was nothing but National Registry prep time. This is where we came in every night and we worked on every station when we do that. Okay, get to me offline and I'll make sure I get it to you. So that's what TBD is there for, because that was nothing but National Registry prep. When we look at integrated out of hospital, oral A and oral B, when we look at static and dynamic and the trauma stations, those 6 stations are going to be what you have to sit. And we were going to, start working on that stuff. If we're allowed to get back to the college, again, this is where that asking you if you were available on a Monday, Wednesday versus Tuesday, Thursday, we would split the class up into who could do what, and we would bring everybody in on differing times, like a 6-to-1 time frame, and have at least 2 instructors. That way we could work everybody through and prep everybody for that. That's why that's there. So that's still a work in progress. I'm hoping that we're looking at doing that, but again, it's going to be dependent on what we're allowed to do. Please note, week 9 on 7/13, that's when your exploratory paper is due by 6 o'clock. All right. And then we got some more tests open up for you. And then having that paper due at least 2 weeks prior to your presentation allows me to, 1, grade it, but also know what you're going to say during your presentation with that. Now, your presentation, as we get down to those days, please realize that those presentations are not due to me until the night of your presentation. So you don't have to send me, your final presentation until such time. You don't have to upload it until you give your presentation. Now, you are all welcome to send me rough drafts. I will not grade it. I'll give you pointers. I'll run through it with you on the GoToMeeting and, pros and cons and everything else like that. But if you don't want me to do that for you, I don't have to. But it's to your benefit. With that. So presentations, again, what will happen with presentations, if we do it live, we'll do it in the high auditorium, 20 minutes, 30 minutes, room for questions, everything else like that. Each person in the group must present. It's not just going to be one person doing it, unless of course you are a group of 1. Then it's all on you. But just realize that I will be opening this up, whether it is live or if it's on GoToMeeting, I will be opening it up for Con Ed. And that will go out pretty much to the region. We can handle 150 people online. So minus, the 12 in class now. Basically, we can have 138 people watching and getting Con Ed for it. And that'll open up to more questions. So, usually when people have to come to a class, it's limited. I know the past couple of years I've done this, we've only got about 5 or 7 people come in outside of the class. But online, there's a chance for another 130 people to come online. So that'll be offered on both, Monday and Wednesday. And then after that, basically we open up, that final week, we open up for all of your comprehensive final exams, which will be Platinum and FISDAP. And between that Monday and that Friday at 5 o'clock, 4:59, you have to pass those exams, that comprehensive exam with a 60% or better. You have 3 attempts at it. All right. Does anybody have any questions? All right, so it is 6:55. Let's go ahead and take 15 minutes so I can get another glass of water, and then we'll come back and we'll start ACLS and lectures and some review, looking at some oral, looking at some question types, some reviews, and some oral, some case studies, and then getting into ACLS. All right. I'll see everybody in 15.